Knock, knock. Wash your hands. Hello, Mr. Hampton. How are you feeling?
I'm feeling okay.
I'm just going to ask you a couple silly questions here. Can you tell me your name and date of birth?
My name's William Hampton. I was born on January 5th, 1934.
Okay, and I'm checking the identification band. All right, I have a couple silly questions for you. Can you tell me where we're at right now?
We are in Danville Hospital.
Okay, and can you tell me today's date?
Today is March 5th, 2013.
And who's the president?
Barack Obama.
Good. All right, so I'm just going to do a quick assessment on you here, okay?
All right.
All right. Can you squeeze both my hands? I'm just going to feel your pulses. Okay, I'm going to take down your gown here and do your legs. Now to do a full skin assessment, you want to make sure that you take off your Teds. You're looking for edema. Check the back of the heels, make sure that there's no ulcers there. Want to check capillary refill on your toes. Check your pulses. All right, Mr. Hampton, can you push down on the gas and pull back up towards your face? Good job. Can you pick your feet up off the bed? Just want to see how far they can get them up and if they can lift them up with any resistance. Okay, I'm going to cover you back up here. All right, Mr. Hampton, I'm just going to lift up your gown here. I'm going to take a look at your belly. All right, so when you check the surgical site, you want to make sure that there's nothing oozing out of it. If you can see anything, what does it look like? You want to check for your drains, see how much output's there, what color it is. Obviously, this is sanguinous. Is it serosang? Is it sanguinous? How's your belly feel right now?
It feels okay. I'm surprised.
Okay, so you want to palpate around the area, make sure that you don't see anything weird. You're going to check your femoral pulses. All right, Mr. Hampton, I'm going to take a listen to you. First, we're going to listen to heart sounds. It's so neat that I can actually hear them.
Well, I am living.
Okay, now we're going to take a couple big deep breaths, okay? Good job. All right. All right, we're also going to listen to bell sounds. Okay. You want to make sure that you check your patient's vital signs, make sure that those are all within normal limits. All right, Mr. Hampton, bright light in your eyes here, okay? And we're checking for pupillary reflex. All right, I'm going to lower the head of your bed down here so we can turn you and make sure, see what your back looks like. You also want to make sure that you check your ID and see what that looks like. Make sure that it's not infiltrated. You're obviously going to flush your IVs before you give anything. Mr. Hampton has two. See what size they are. Okay, and may I have a helper to turn him? All right, Mr. Hampton, we're going to raise this knee. And hold on to the side of the bed rail if you can. Okay, so when you turn them from post-op, you want to make sure that there's no needles or anything coming from the operating room. You want to check out the back, make sure that there's no pooling of blood and no ulcers. Mr. Hampton here happens to have a stage 2 ulcer. And then we're going to listen to the lungs posteriorly. Couple deep breaths. And last time. I'm going to get Mr. Hampton a pillow since he has a little pressure ulcer. Make sure everything's neat, no wrinkles. Alright, Mr. Hampton, I'm just going to set you up here. And last thing I'm going to make you do here is, can you stick out your tongue for me? And can you give me a nice big deep breath and a cough? Good job. Are you comfortable right now?
Yes, I am.
Okay. I'll be in to check on you in a little bit.
Thank you.